ACLS 2010 Algorithm Review. V-Fib Pulseless V-Tach. V-Fib Pulseless V-Tach. This is the adult cardiac arrest algorithm. We start off by performing CPR and putting on a cardiac monitor. From there we check the rhythm. If we have a shockable rhythm, we have V-Fib Pulseless V-Tach. No shockable rhythm, we have asystole or PEA. You will see that the algorithm on the left-hand side is for V-Fib Pulseless V-Tach, whereas on the right side of the algorithm is for asystole and PEA. For this video, we're going to be using the left side of the algorithm, the V-Fib Pulseless V-Tach. We'll start from the beginning. You're going to start by doing CPR, give oxygen, attach a monitor and/or defibrillator. Assess the patient's rhythm. Is the rhythm shockable? If not, go to the appropriate algorithm. If yes, we're going to continue on with the V-Fib V-Tach algorithm. The patient will be in V-Fib or V-Tach. Go ahead and shock the patient or defibrillate. When we defibrillate at 120 to 200 joules biphasic or 360 joules monophasic. You will then perform 2 minutes of CPR. While doing CPR, you want to establish IV or IO access. After 2 minutes of CPR and establishing IV or IO access, you need to assess the rhythm. Is the rhythm shockable? If it's not, go to the appropriate algorithm. If the rhythm is shockable, then go ahead and shock or defibrillate the patient again. Continue with 2 minutes of CPR. While doing CPR, go ahead and administer epinephrine. You can administer 1 milligram of epinephrine 1 to 10,000 every 3 to 5 minutes. Also at this time, consider placing your advanced airway and waveform capnography. After 2 minutes of CPR, assess the rhythm. If the rhythm is not shockable, go to the appropriate algorithm. If the rhythm is shockable, go ahead and defibrillate your patient. Continue with 2 minutes of CPR. While doing CPR, you can now administer amiodarone. Also, treat any reversible causes. Now here's a note. The initial dose of amiodarone in V-Fib Pulseless V-Tach is 300 milligrams. The second dose is 150 milligrams. You may use lidocaine if amiodarone is not available. The initial dose of lidocaine is 1 to 1.5 milligrams per kilogram, and the second dose is 0.5 to 0.75 milligrams per kilogram. Assess the rhythm. If the rhythm is not shockable, go to the appropriate algorithm. If the rhythm is shockable, go ahead and defibrillate your patient. After defibrillation, continue CPR for 2 minutes and again repeat epinephrine 1 milligram every 3 to 5 minutes. After doing CPR for 2 minutes, assess the rhythm. If the rhythm is not shockable, go to the appropriate algorithm. If the rhythm is shockable, go ahead and defibrillate your patient. After defibrillation, continue CPR again for 2 minutes and consider the second dose of amiodarone and also look at treating reversible causes. Continue in this cycle of 2 minutes of CPR and then assessing the rhythm. You can keep getting the epinephrine 1 milligram every 3 to 5 minutes. And as a note, you may give 40 units of vasopressin in place of the first or second dose of epinephrine. Also keep going until you've given the first and second dose of amiodarone or lidocaine. If there's any change in the rhythm, go to that algorithm for that rhythm. Thank you.